Hi, Emily.
Hi.
My name is Dr. Mad. How are you doing today?
Doing well. How are you?
Good. So, you're here as a first-time patient, right? I'm going to go ahead and ask you just a few questions. I want to make sure that I have all your information, and then I'm going to go over your main goal for today's visit. Can you please verify your first and last name?
Emily Johnson.
Perfect. And your date of birth?
March 2nd, 1999.
Okay. 99. All right. Can I please have your full address?
Sure. 555 Ringneck Lane.
Okay. City, sorry.
In Westfield.
Okay, that's Illinois zip code.
60124.
60124. Okay, can we have a phone number for you?
Sure. 708 296 4089.
Perfect. Your occupation?
I work in production, so we put on fashion shows.
Okay. Okay. And what's the reason for today's visit?
Yeah, I just got married about 2 years ago, and me and my husband just got a house. So now we're deciding to have babies soon. So I just wanted to check in with you, see that everything's okay, and that we could start trying.
Okay, that's wonderful news.
Yeah,
I'm
thank
so
you.
glad that you guys took this decision. Let's go ahead and go over some questions here. So, definitely it's very important to take care of your body and to make sure that everything is healthy before having a baby.
Yes.
And that's what we're going to do today. Are there any specific questions that you would like me to answer today?
Yeah, I would just like to see if my hormones are balanced out and everything's looking okay.
Okay. All right. And who is your primary care physician, in case we need to get a hold of him?
Her name is actually Sarah Johnson as well.
Are you guys related?
No, we just have the same last name.
Okay. 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 What is the age of your first period?
Like how long ago was my last?
How old were you when you got your period for the first time?
14.
Okay. Very good. Okay. And date of the first day of your last period?
What's today? It's July. So I would say July 5th.
Okay. And is your menstrual cycle regular?
Yes,
All
it's
right.
pretty consistent.
What is the usual number of days from the first day of one period to the first day of the next period? So how many days are in between?
I would say like 25 days.
25 days. Okay, that's good. And for how many days does the menstrual flow last?
About 5.
5. Okay. And how would you consider it? Light, heavy, short, long, or painful?
It is painful, but I would say it's pretty light, actually.
Okay. And no pelvic pain or cramping?
I do get a
You
lot of
do.
cramping, yeah.
So would you say always or sometimes recently?
It would be like the first 3 days of it
Okay.
starting.
Do you spot or bleed between periods? Okay. Do you have any pelvic pain between periods?
No.
Any premenstrual symptoms other than cramps before your period?
I could tell like my mood changes a little bit, but that's about it.
Okay. Do you have any acne or oily skin?
Yes, I do have acne.
Okay.
Mm-hmm.
Have you noticed any breast discharge?
No.
Okay. Have you noticed any extra body hair on your body?
No. Nothing out of the ordinary.
Okay. And what has been your maximum weight?
145.
Okay. And your minimum adult weight? Your lowest?
Maybe 130.
Okay. Have you ever had a sudden weight change?
Mm-mm.
Okay. Right now, do you feel that you are underweight or overweight?
Just right in the middle, where I need to be.
And how many meals do you usually eat per day?
3. And like a snack in there.
Do you follow a particular diet or any specific dietary habits?
Well, ever since we made this decision, I have been eating a lot of fruits and vegetables and just been more conscious of being more healthy, health conscious.
Perfect. And have you ever had a pap smear?
Yes.
All right. Do you remember when it was the last time?
I just got one maybe like 6 months ago.
Okay. Okay. And was it normal, abnormal?
Yeah, it was normal.
Okay. Have you ever had a mammogram?
No, I have not.
Okay. And do you perform breast self-exams?
No, I do not.
Okay. Have you ever had any surgeries?
No, just my wisdom teeth.
Okay. Are you allergic to any medications?
Nope.
Okay. Are you taking any medication on a daily basis?
Yeah, just because of the acne, I'm taking that spironolactone and then a vitamin D supplement.
Okay. Perfect. I'm going to go ahead and take your blood pressure.
Okay.
It's very important to make sure that the medication are not having any side effect.
Yeah, I think that spironolactone does affect with pregnancy, so I might have to stop taking that.
Yeah, I think we can definitely try to find a medication that will be safer to take even before you get pregnant.
Okay.
Okay, blood pressure is normal, 110/70. Any flu-like symptoms?
Mm-mm.
Yes, let's check your temperature. 99.6. And we're going to check your heart rate as well. Go ahead and relax. I'm going to have you take a deep breath in. Breathe out. Good. And again, breathe in. Breathe out. Breathe in. Okay. Okay, perfect. Oxygenation is 98% on room A. Heart rate is 72. I'm gonna have you get dressed in this gown. I'll step outside and I'll be right back, okay?
Thank you.
You're welcome. I'm going to go ahead and put gloves on. I'll start by palpating your thyroid gland and your lymph nodes. Thyroid gland is non-palpable. I could not feel any lumps. And lymph nodes are also normal in size. I'm going to have you open your eyes. I'm going to check your pupils. Good. Sorry. Okay, I'm going to go ahead and listen to your heart. Is it okay if I open the gown on this side?
Mm-hmm.
I can hear only S1 and S2. No S3, no S4. Going to go ahead and listen with the bell. I'm going to check for murmurs. Okay, I'm going to ask you to take a deep breath in can hold it in for 1, 2, 3. Breathe out. Good. No murmurs. Good. Listen to the jugular vein. Perfect. No swishing sounds. So what I'm going to do now is I'll ask you to lift your right arm above your head. I'm going to check the lymph nodes and the mammary gland under your armpit, okay?
Okay.
Perfect. So I'm just going to slowly palpate. Let me know if you feel any discomfort or pain. Very good. So let's go ahead and switch. So there's breast tissue even going through the armpit. Sometimes after you get pregnant, you might see a little bit of swelling in this area, which just means that it's trying to get used to and get ready to make milk. And the whole mammary gland is going to get a little bit enlarged in the process. Everything looks very healthy. Now I'm going to go ahead and do a breast exam. So I'm going to look for any asymmetry, redness, or lumps. Is that okay?
Mm-hmm.
Okay. I'm not noticing any increased swelling. I'm going to go ahead and use a circular motion. Let me know if you feel any kind of pain.
Okay. Yeah, no pain.
Great. Yeah, it's been about 15 days since your last period, so this is perfect timing. There's not a lot of pain. Okay, let's go ahead and check the other side. problems. Good. Going to go ahead and do an abdominal exam, and then it's going to be followed by a pelvic exam as well. Going to go ahead and just visually inspect. I want to see if there is any redness, discoloration, or swelling that's visible to the naked eye. Going to listen. Very good. I'm going to go ahead and percuss. Very normal sounds. I'm going to go ahead and palpate. Let me know if you feel any discomfort.
Okay.
Starting with thoracic area and the rib cage. Okay, palpating the right ovary. I'm not feeling any enlarged organs. Palpating the left ovary. Okay, so the right ovary was a little bit larger than left. That may be very normal. It's almost the same thing as all women have a breast that's larger, so it's normal. But I would still want to follow up with an ultrasound so we can make sure. Okay. Okay, Emily, I'm just gonna go ahead and lift the gown up. Okay. At any moment, if you're feeling discomfort or uncomfortable, just let me know.
Okay.
What I'm gonna do is I will explain everything as I'm doing it step by step so that you are prepared for what's coming, okay?
Thank you, doctor.
You're welcome. I'm going to go ahead and use a speculum, so it's going to feel a little bit cold.
Okay.
Go ahead and take a deep breath in and breathe out. Okay, so speculum is in. Any discomfort there?
No.
Okay, great. Visualizing the cervical canal and the cervix. Definitely it's normal color. I'm not noticing any polyps. Okay, we're going to do a few tests today, so we're going to get some samples so that we have everything on file.
Okay.
Okay, you're gonna feel kind of like a pinching sensation.
Great.
Okay, all done. And I'm going to go ahead and take one more sample. Go ahead and take a deep breath in and exhale. Good. Okay, so you're gonna have maybe a little bit of spotting.
Okay.
Okay. Perfect. You're going to feel kind of like a pinching sensation again. Now we're just going to remove the speculum, okay? This should not hurt at all. Perfect. Just going to go ahead and gonna put this to be sterilized. Okay. I'm gonna have you get dressed and we're going to discuss the results, okay?